In today's Health Watch, new research finds there may be an increase in autism diagnosis rates among U.S. children. The CDC report found about 1 in 31 children were diagnosed by the age of 8 in 2022. CBS News medical contributor Dr. Celine Gounder, editor-at-large for public health at KFF Health News, joins us now. Good morning.
Good morning.
So HHS Secretary Robert F. Kennedy Jr. has said that the U.S. is seeing a growing, quote, epidemic of autism, but what are we learning from the data that we see?
Well, so what we saw in this most recent CDC report, and by the way, the CDC is the HHS agency that collects this kind of information, it's kind of the surveillance that they do. They go to look at health records, educational records of kids in this case, 16 different surveillance sites to see how many of these kids are being diagnosed with autism. And that could be because they have a medical diagnosis, because they're accessing certain special ed. And we saw the rates go up from 1 in 36 to 1 in 31 over the last 2 years. Part of this is being driven by better diagnosis in certain populations, particularly children of color. We've seen the rates go up over time as diagnosis has gotten better. We see higher rates of diagnosis among boys versus girls. That's been a long-term trend, and we're also realizing girls may have more autism that's going undiagnosed. And there's a lot of regional variability. In some communities, it's 1% of kids, and some it's 5%, which really goes to show there is definitely some of this is being driven by whether people have access to the services and to the diagnosis.
Why is it happening, and is it preventable? Kennedy seemed to say that it's preventable. Why is it happening, and I've never heard that it's preventable before.
We don't know that it's preventable because we don't actually know completely what causes autism. Genetics are definitely a factor here, and your genetics, I don't know how preventable it is, unless you're going to be doing some sort of genetic editing of people to cure, their genetic predispositions. But there are other factors at play for sure. Environmental, for example, immunologic, your immune system, your microbiome, which is the bacteria in your gut. We think that there are some correlations there. Some of the hypotheses are, could it be microplastics in the environment? We're seeing increasing exposures, right? Just last week I was talking about diabetes, and if you have diabetes during pregnancy, whether it's gestational or type 2, that may also be a risk factor. Air pollution. There are a number of things we really need to be studying more carefully.
Robert F. Kennedy Jr. said that he is going to find the cause of it by the fall. Is that possible?
I mean, look, even when there is a very tight correlation, say smoking and lung cancer, to prove that definitively took us decades. The only way to come up with an answer by September is to make up an answer.
I guess we'll stay tuned to see if that happens. Dr. Celine Gounder, thank you so much.